We'll go ahead and get started. This is Jackie. She is from Pathways Behavioral Services, so she's going to talk to you a little bit about some drug trends and things that you can be aware of in the community.
Oh, thank y'all for coming. That's great. And if you pick up an evaluation form, and if you guys would do that for me before you leave today, that's fantastic. We have to document to the state what we're doing. So my name is Jackie Preston, and at Pathways I have a dual role. Half of my role is comprehensive prevention, which includes all substances for all ages. And then the other half of my role is compliance. Woohoo! There's some fun, right? And I previously worked for a large healthcare system and did a lot of work getting us ready for Joint Commission. And so they said, hey, how about if you give up doing the tobacco work that I used to do, kind of like Brian here, and he moved on so I know him, and then do compliance. So I wear two different hats, but I really enjoy this part. So I'm going to go through some information fairly quickly because I want to give you some time to ask some questions. So when we look at drug trends, probably one of the most significant trends, not only in the United States, but specifically in Iowa, relates to marijuana. And so this shows you a grow operation on the top right hand, and then processed marijuana. So you see the dried buds, then it broken up, and then it rolled into a joint. So there's a lot going on with marijuana. And what you just saw previously was what most people think of. This is not what most people think of. But this shows you what are the trends related to marijuana as we see more and more what are called edibles. Initially, they were called medibles because they came out in states that passed the medical marijuana laws. And now as we see more recreational legalization, we see more of these products. While they are not legal in Iowa, what happens is that people go to states where it is legal, and then they bring them back to Iowa, which presents us with some unique challenges. Those challenges are when people transport them over state lines, what they will do is they will remove the labeling that identifies that it has THC in them, and then unfortunately we see children get a hold of them thinking that they are just gummy bears or gummy worms or fruit slices or, you know, a cooler drink or whatever, not recognizing that it is a cannabis-based product and has THC. So our calls to emergency rooms and the Poison Control Center are up about 500% as it relates to marijuana. So it is definitely an issue here. And people, you know, take off that packaging because they don't want it to be identified because of the legal differences between here and other states. So have any of you seen any of these kinds of products? This is just a small sampling for you to have an idea of what's out there. But if you look at like the fruit slices, the sour peach rings, or the gummy worms, would you be able to tell the difference between that and just the regular candy? So that's what presents us with some real challenges here. And how about the gummy bears? Because we know gummy bears have been around for a long time and are very popular. If you didn't see this side and you only saw that side, would you be able to tell the difference? The answer is no.
Do they taste?
They taste exactly the same. There's no difference, and there's no specific flavor related to the marijuana. They put ingredients in that kind of mask any flavor to that. So yeah, they tend to have pretty strong fruit flavor to them. So the fruitiness covers it up. So when you think about gummy bears, you know how they're pretty strong. They're not like a mild fruit taste. They're pretty strong. So that tends to mask anything else that would be there. Great question. Thank you. So this is kind of some background information for you to also understand kind of the nature of the issues that we have with THC now. This shows you the average THC, which is tetrahydrocannabinol, and CBD, which is cannabidiol. THC is the active, the psychoactive one. It's what causes the high. It's also what causes the change in brain function where people have, hallucinations, feel relaxed, all of those things. So those changes occur because of the THC part. The CBD part is one of about 200 chemicals that we know are in a marijuana plant and can be extracted. The CBD, the cannabidiol, is not psychoactive. So when you read research studies that look at marijuana as medicine and what can be done, and you look at some areas where there's possibly some evidence that it can help, especially as it relates to seizure disorders, certain types of epilepsy, Dravet. There's certain things where the research is promising, but the part that's promising is not the THC part, it's the CBD part. And so there's only right now one company in the world that is producing pure or nearly pure CBD. It's a company out of the UK, and then they are sending that to test sites in the United States, including University of Iowa hospitals and clinics, who are doing research with that. So when we talk about kids getting medical marijuana, particularly for seizure disorders, or even adults as it relates to like glaucoma, wasting syndrome associated with HIV. There has been studies related to post-traumatic stress disorder. Those have not gone well. It has shown to actually be contraindicated for most people because of the hallucinations associated with it. So that does not show a lot of promise, but there are some things that do. But it's specifically relating to higher level of CBD and little to no THC, which is not available here. So the issue with children, when people will, for example, go to Colorado and get it in Colorado or Washington, what they're getting has still higher levels of THC, and so still does the damage to the developing brain compared to what's being done in medical test facilities, which is nearly pure CBD. Does that make sense to everybody? Did y'all know that ahead of time? No, so you already learned something? Woohoo! Okay, and you can see this is marijuana, and whether it is recreational marijuana or medical marijuana, this is the same. It's the same thing. It's just how it's packaged. So you can see what's happened with the amount of THC in it versus the amount of CBD, which has been pretty consistent or gone down. So it's just like growing tomatoes. It's been hybridized, and so what do buyers want? They want to get more of the high. So what do? Hybridize to get more THC and try to get rid of the CBD, because CBD insulates against the effects of THC. So it's kind of like if I took a tissue and I put THC on it, let's pretend that's water, it's going to soak in, disintegrate it. That's what happens with THC. CBD would be like if I took that tissue and I put a layer of Vaseline or a layer of Crisco on it, and then the THC couldn't get through, wouldn't be absorbed. Okay? So there's a big difference between what's being done in legitimate clinical trials and what some people are getting, which we know that there's a lot of issues with it. So the potency has about tripled in the last 20 years. It's the same thing whether it's sold in a dispensary as medical or recreational. We know that heavy marijuana use impairs physical, mental, cognitive abilities, career, lots of things. We also know in looking at a workplace that it's associated with more absences, workman's comp claims, a lot of different issues there. There's currently a lot of legal cases looking at companies and being able to have drug-free workplaces versus laws that say it's legal. It's not any different than alcohol, and that's what the courts are ruling. If you do this on your own time, that's one thing, but if it affects your ability to do your job, it's another thing. The difference is alcohol is generally cleared from the system in 6 to 8 hours. Marijuana, we've got about a 28-day life. Okay, so different. Yeah. So we can look specifically on youth, and there have been some studies related to marijuana motivation, which we've known for a long time, memory and learning. And in particular, there have been studies that look at a drop in IQ. Specifically, it's verbal IQ. And so when we look at verbal IQ, how significant is that to a child's ability to learn? Right? They have to read a lot, they have to be able to interact, they have to be able to talk, and so there's huge, huge implications. And so what we saw was about an 8-point drop related to verbal IQ, which if you know anything about IQ tests, that's a significant drop. 8 points takes people usually from average to below average. So it has all kinds of implications related to success in high school, ability to get into college, ability to pass the exam to get in the military. There's some studies that are going on about that related to someone's marijuana use. So there are some significant things there. This lets you know about Iowans entering substance abuse treatment. So this is all populations. And you can see that marijuana now is over a quarter of the people who are going into treatment. So the people that say it doesn't cause problems, there's no risks for it, I would say these statistics will point to something different. And then we can look at juveniles. And in the time that I've worked at Pathways for about 4.5 years. I've been a volunteer for over 20. It used to be that alcohol was 66%. It used to be, if we go back even 5 years ago, you could flip these two. Okay? So that's what's happened in the last 5 years. Huge difference. So when we look at the Iowa Youth Survey, we can also look at the difference and figure out when it's happening, and our big jump is 11th grade. We have some use prior to that, but our big jump is at 11th grade. And you notice how ever use has gone up dramatically. Iowa Youth Survey will be done again this year in 2016. We are projecting that this will go up even higher. Why is that? Because anytime you reduce the perception of harm, you increase use. And that goes for every substance and has been that way for decades. So we can look at those who use heavily, and what we know, I try not to use the term gateway drug because it's not like automatically this is what's going to happen, but we do know that for people who use marijuana, we do know that many of them also go on to use other drugs. And you can look at the different drugs that are up there and the increased risk for them using other drugs. Pretty significant, right? So second leading substance for which people seek out and get treatment, the first one is alcohol, and that again is talking about all populations. We also know that marijuana now is responsible for about 40% of all emergency room visits that involve an illegal substance. That's shocking to a lot of people. They don't really hear about that. So it is definitely an issue. We can look at teens and what's happened with use, and again, this points to when we have a lower perception of harm or a lower perception of risk, which right now the perception of harm is the lowest it's been since 1983. So what happens with use? If I think that something's not going to hurt me, why not try it, right? And that's what we hear kids say. So, and for the first time ever, in 2014, the use of marijuana exceeded the use of tobacco. So we're really glad that the tobacco numbers are coming down. Not so glad that the marijuana numbers are going up. So when we talk about marijuana in adults, it's about 1 out of every 10 to 1 out of every 11. It's kind of in between that range of those who use who will go on to become addicted. With youth, it's 1 out of every 6. And that's because the youth brain is not done developing. Neural pathways are not done being laid down. We have so much that's still happening with that development. And in effect, what marijuana does is where those pathways are being laid down, it sets up a barrier. It sets up a roadblock so that those pathways do not continue to be developed. And so it has all kinds of effects, again, on IQ and all those things. But we also know that some people are more susceptible to becoming addicted to all different kinds of substances. It's also true with marijuana. The younger the person is when they use, the more likely it is that they will become addicted. All right, move on. Prescription drug abuse. Any of you hear anything about this recently? Okay, huge, huge issue. I'm also one of the people that coordinates the drug disposal days, and I've worked with your sheriff and law enforcement here, which is wonderful as part of the Bremer County Community Partnership, which is great. So we're trying to do things because we know that prescription drug use is a big problem. Most people identify that they, perhaps have taken something in an inappropriate way. You don't have to raise your hand, but my guess is if I ask you here, if you always, for every prescription you had, follow the doctor's orders. Or if you maybe said, oh, you have a headache, I got some prescription meds, try, people do that. And there's lots of reasons not to, but people do. And as, again, perception of harm goes down, people think that it's okay. So they they share scripts or they leave scripts in a cupboard, and we know that certain populations are more susceptible with that, particularly the elderly. You talked about working with an elderly population. You know, they will save all their scripts because they don't know when they might need it again, and so it sits in cupboards, and so then we have other people that see that there and think, oh, I can try this. Have y'all heard of farm parties? Anybody heard of farm parties? It's not F-A-R-M. It's P-H-A-R-M. Farm parties. You will have assignments to gather up prescription medications and bring them out to a party, and then people will try different things and see what happens. There's an alternate version called a Skittles party. And now this is not just another thing that I'll tell you about in a minute with like the real Skittles, but this is the Skittles slogan, which is Taste the Rainbow. You all remember that Skittles slogan? And so people will get assigned a color. So you bring something that's blue, you bring something that's yellow, you bring something that's red, and then they'll lay them out and they'll try one of different colors, and it's Taste the Rainbow. I don't know about you, but to me that's terrifying. Terrifying. And so when you hear about emergency room visits and when you hear about overdoses and you hear about youth whose brains are literally frying, it's because of some of the drugs that they're taking and the mix of the drugs. So we have a big issue with scripts. Just so you know, it's not just youth that have this problem, however. They just tend to do it in a little more risky ways because that's part of adolescent brain development, right? Trial and error, risk, seeing, pushing boundaries, all that. So it also is a problem with adults. So we can look at teen use. Most of them don't do it. A quarter of them say, yeah, I've done it at least once. Okay, a quarter. Their parents don't care, which is also interesting. Their parents say, oh, you know what, I feel better if they're doing prescription drugs than if they're doing something else. They assume that it's safer. Is that true? No! But again, perception of harm is something that's really, really important. Most of them who have done it before the age of 14, and they do think that it's safer. There was actually a study that was done that asked parents, if you thought that your child's behavior could improve or academic performance could improve, would you encourage them to take a prescription illegally? And a third of them said yes. So when we look at abuse prescriptions, 3 big categories: opioids, pain relievers, some people will say narcotics, depressants, people that are wanting to calm down, and then stimulants. So somebody that says, I've got to, drive my truck route farther, or I've got to stay awake for an exam, okay? So those kind of let you know what the main categories are. Not only do we have a problem with the prescriptions themselves, but what we are now seeing, one of the big trends, is a huge increase in heroin. We thought that heroin was kind of like, over, and now we're seeing it come back. And we've seen some neighboring states and neighboring larger cities where it became evident first, but it's made its way to eastern Iowa. Some of our main pipelines are from Chicago. You would probably guess that, right? St. Louis, you would probably guess that, right? One you might not guess, Madison, Wisconsin. Okay? And they've had a huge problem related to heroin. What we know about some of those areas is that we can look at prescriber practices and the number of pain meds that are given post some type of injury or surgery, and then the scripts run out. Maybe doctor shopping, you've all heard of that, right? Doesn't work. People get desperate for some kind of pain relief, and they can get heroin at about, a quarter to a fifth the cost. It's cheaper. Okay? So they will make that transition over to heroin. So really, really big problem. So I'm going to give you a personal story related to that. I have had to have 2 surgeries on my hand. And the most recent one that I had was a Dupuytren contracture. Anybody know what that is? A little tumor that forms in the tendon sheath, and then the finger pulls down and you can't straighten it up. So I had to have surgery for that. And I've had some issues with taking medication in the past, but they said, no, we're going to try it again. So get done with my surgery, right, which is outpatient, and I'm going to go home with my cast on, and I get a script. Anybody, what did I get a script for? Oxycodone. Oxycodone. Now they told me you're probably going to need this for 3 to 4 days, and you're going to take 3 a day. Okay, so how many does that make? 9 to 12, right? Guess how many was in my script? 60. 60. Okay? I had a horrible reaction. I vomited profusely. My husband is holding my head up because I can't use my hand, right, to support myself because I'm throwing up so much. So he calls in and says, she's having this bad reaction again. She's vomiting. You know, it's not going well. Can you do something? So they said, yep, we'll change her script. So we're going to switch her. Now we're going to put her on, anybody want to guess? Next level down. Tramadol. So now I get Tramadol. And they say you're going to need it for probably 3 days. And guess how many was in that script? 60. And guess what? I reacted to that again. And so they said, okay, we're going to have to really go with something else. So now I get Tylenol with codeine. And guess how many's in that script? 60. So what do I have sitting in my medicine cabinet? Right? And do you think that that's an unusual case? Because I'm here to tell you it's not. And there are reasons behind the scenes that are creating that to happen, and a lot of it relates to managed care. I'm probably preaching to the choir here. You probably all kind of have an idea, but if somebody is on a narcotic pain medication, and let's say that they only gave me 10 and it wasn't enough, what do I need to do to get more of that same narcotic pain medication?
Call the doctor and get another script.
Wrong answer, but thank you for saying it because that's what everybody thinks. Call the doctor and have to go back in and have to have an office visit where they have to do all the vitals, they have to do the pain assessment, they have to do everything all over again, which what does that equate to? Money. And guess what? The insurance companies aren't going to pay for it because it's not part of the routine care and we should have planned better for it. And so then the individual is ending up having to pay those charges out of pocket themselves. So they complain. And they talk to the providers about it, and the providers say, well, that's stupid, so what's the provider going to do? Take care of the patient and say, we'll make sure that doesn't happen to anybody, so we're going to write a script for 60. Y'all see the problem? Mm-hmm. And it has led to an epidemic where people get addicted to pain medication. Oh, I have this pain medication from this surgery, and man, I was out working in my garden, my back's a little sore, let's try some, right? People ever do that? Okay, so you guys get the idea. So we see people then when they run out of those pain medications, which now they cannot function without them, it's not that they're getting a high from it, it's that they need it to cover up pain, right? And so they continue to need that medication to function what they term normally to feel okay, and so then many switch over to heroin. People think, okay, it's only the depressed, homeless person, et cetera, et cetera, et cetera, that gets hooked on heroin. I'm here to tell you that that is not true. Okay? There are no boundaries in terms of race or ethnicity or age or education or economic. It's across the board. It is across the board. So we have some states where there have been increased deaths specifically related to prescription opioids and then the move to heroin. And you'll notice the one that I made stand out for you. Iowa. Then we have synthetics, man-made chemicals that are designed to imitate something else that's out there. Some of them are made to imitate marijuana, some made to imitate amphetamines, some hallucinogens. They get advertised as other things, so it's trying to cover up what they really are. They avoid legal consequences by putting labels on them that say not for human consumption or not to be sold to minors. Sticking a label on something does not mean that it doesn't happen, right? So, what's the problem with it? It's never what's advertised. People don't know what's in it. It's not controlled. It can be any chemical, any combination of chemicals. There's no regulating authority by the FDA because it's not sold as a food or a drug. It's sold as something else. What are we talking about? Here's the synthetic marijuanas. They're synthetic cannabinoids. So these are some that are packaged. K2 has been around for a long, long, long time. We have multiple versions after that that are available. You can buy these at head shops. Sometimes you find them in tobacco stores. You can find them in some other retailers. You can find them at truck stops, convenience stores, and they are sold as things like plant fertilizer, bath salts, you know, all kinds of things that they put on them. But people who know what they're looking for know what to ask for. So it's not marijuana at all. Mixed up, resealable packages, $20 to $50. What they do for the synthetic marijuana is that they get giant vats of plant material, and then they will take a sprayer, kind of like you. Have you ever seen where people like spray their weeds and they've got those plastic sprayers and they pump them and they spray the chemicals on? So they'll get this giant vat and they'll spray these chemicals, right, that have been cooked up in somebody's garage, all over this, or plant, all over this material. So the problem is, let's say there's one here, and I've been spraying, and I see somebody while I'm spraying, and I'm talking to them, okay? And then I go over here and do this. So one time somebody gets some, and it's from this part over here, which has very little of the chemical sprayed on it, and they think, wow, that didn't do very much for me, I must have to use more, and the next time they go and buy it, they get some that comes from this over here, because we have inconsistent application of the chemicals, so now they use more, and now it's got more of the chemicals, and so then they overdose. Okay? THC is a partial agonist. Synthetics are full agonists. So what that means is on those neuroreceptors, when we look at marijuana, when we look at real marijuana and THC, it fits part of the way. So it sets off those feel-good, you know, the release of all those other chemicals in the brain. The synthetics, they've studied them. It's based on research. It's a full fit. It's a 100% fit. So the addiction rates are higher. The overdose rates are higher because it completely sets off that reaction. Does that make sense to everybody? Okay. Seeing a few nods. All right. So here's some other different ones. So if you see packages with things like this, you're going to know what it is now. You can see signs and symptoms. Sound like a good time? You can look at the number of calls, and I'm waiting for this to be updated. The Poison Centers update they do mini updates every year, but they do big updates every 5 years, so I'm hoping that we're going to have some updates coming out pretty quickly here. Here's another way they're packaged, bath salts. So, you know, somebody might look at this and think that, you know, somebody's doing a line of cocaine, right? But it's actually bath salts. They can be snorted, they can be mixed in, they can be melted down and injected. They're used a number of different ways. So not anything to do with a bath. Different names for them. They are a synthetic cathinone, which is a synthetic version of a cat plant, which you see up in that top right corner. Usually brown or white, and again, they can be used a lot of different ways, sometimes called fake cocaine or fake meth. Again, where they're sold, and you can see the price ranges from $25 to $50 for a 50 milligram packet. So here's some of the different ones that are out there. Unfortunately, the people that are manufacturing them also find ways to skirt the law by just changing one little molecule. And so they are constantly having to go to the emergency session of the Iowa Pharmacy Board to have rulings, and then to the legislature to get laws put in place to make the different combinations illegal. So it is a perpetual game of whack-a-mole. What are they going to do next? Let's get that one. Now this one. And they frankly can't keep up with it. So lots of, again, pretty negative effects out there related to the cathinones. So Iowa Board of Pharmacy has taken emergency action. They've outlawed, made illegal a number of different compounds, and they keep adding. And then, you know, you might say, drug trend, really? Alcohol. Well, what's interesting with this is that when we look at youth populations, alcohol use has actually gone down overall, but among those that use, the amount used, the binge part has gone up. Okay, does that make sense?
Just a couple minutes left.
Okay, thanks. So we have guidelines, and we tell people if somebody ever has a family history or an unusual response themselves, their recommendation is 0. We say 0 for any illegal substances or drugs. We talk about somebody who doesn't have a family history, did not have an unusual first reaction, not more than 1 standard drink in an hour, not more than 2 if they're drinking daily, and not more than 3 ever on any given day. There's some really good materials for people in healthcare professions called the SBIRT. I don't know if you've seen that or heard that, but it's really good. This is some information I thought that would help you. I'm not going to do that one. I want to show you some other pictures really quickly. Let's see. I won't have time to show you all of this, but I want to show you a little bit. Where is, here we go. There's a huge pro-drug culture right now. There are brands of clothing that are meant to hide a stash. One is the Aperture brand, and what you see over there is a little stash pouch that's up inside of it. So law enforcement checks, there's nothing there because it's in a little stash pouch. Another one is called 40 to 5, and 40 minutes to 5 is what? 40 minutes before 5 is 420. What's 420? Marijuana. Celebrating. October 20th, Marijuana Day, right? Covered up. This is about dabbing, where they take marijuana, cook it down, and they make what's called honey or butter or oil, highly concentrated. And so this is, you see the honey oil, and it's got stash pouches up in the caps as well. Grassroots is another one. Get it? Grassroots? Yep. And you can kind of see where they've got little places for it to be put up inside the hat. Sour diesel is a specific strain of marijuana, and notice sour diesel kids. Because we, target kids. This is about something different. The double styrofoam cup. This is about syrup, which is where they take Skittles and they take cough medication and mix them. Also called dank, drank, purple dank. You can hear all kinds of names for it. So this shows the cough medicine with codeine and then mixing it up. Sprite and Jolly Ranchers or Skittles are used. Some more outerwear. Dab. If you see 710, here you can see what it is. 710 is just the reverse image of oil. So if you see something with 710, that's what somebody's talking about. So all this is important to all of you because you might notice when somebody comes in what they're wearing. It might give you, and does that necessarily mean that they're always doing it if they have a hat or the shoes with the stash pouch on them or the belt clips with it on them or learning how to cut an apple to be able to turn it into a pipe? There's a bunch of signs there. Again, these are some of the things that are out there so people can cover up alcohol or can cover up drugs. There's also ways where people have parties that they'll put cat stickers over the alcohol in their hands so their parents don't know what's going on. There's containers made to hide them. This is one of my favorite. They look like tampon holders, but they're called doob tubes. Okay. You can see containers for what supposedly is lip gloss, but it's not. Dog tags that actually have a little piece that flips open where they can put some of the shatter or the honey oil in them. Some of the different pipes that are out there and how to do dabbing. Again, this shows you a lot of different products that are available. All kinds of instructions for how to use it, how to use the prescription drugs, how to hide them. And then we see all this Galaxy stuff. This is about synthetic drugs, electronic dance music. So when you see these things and you think, oh, that's cute. Now, could a kid walk into Spencer's and say, hey, I really like this because it's got a cat? Hey, I really like it because it's got stars? Yeah, but there's also a whole culture who knows what it's really about. So you really have to watch for it. Electronic cigarettes, usually anything that's electronic cigarette can be turned into a marijuana use device as well. So that was a lot of information really quickly. I want to let you know that you can sign up for National Institutes of Health. I brought two to just show you what they look like, where they do a drug trend alert, and they'll let you know what's happening. So go to National Institute on Drug Abuse, or NIDA, and you can set up to get alerts when there's anything that's happening with drugs that are making their way back in. All right. So, any questions you have for me? That was a lot, really fast, right?
What's the dabbing?
Where they dab is like where they cook down the marijuana. It's like the high concentrate like hash, but it's even more concentrated, and then it turns in, depending on how they cook it, they can mix it and turn it into something that's kind of like a lip gloss that's creamy, or they can make what's called shatter, where it's cooked where it gets really, really hard, and it's like little pieces of like glass, basically. So dab usually refers to the liquid or the creamy version.
Dab.
Yep. Yep. Exactly. Did you guys learn anything?
Oh, yes.
Worth your time?
Yeah.
Yes, because they're all going to go home terrified.
It's very disturbing. I find it very disturbing myself. Yeah.
Crazy.
Yeah. I mean, there is some good news out there because, you know, when we look at youth, alcohol rates are way down, tobacco use rates are way down, but then there's other things, and so it's kind of like this all the time. So, yeah. Thank you very